Well, President Obama saying that he wants to end the political bipartisanship, or the political partisanship rather, in the health care debate, and calling on Republicans to offer their reform ideas at Thursday's summit. But can the meeting really achieve its goals and end the stalemate on health care reform? For a fair and balanced debate, Republican Congresswoman Miller from Michigan and former Texas Congressman Martin Frost, a Democrat and a Fox News contributor, join us now. Let me ask you, Congresswoman Miller, do you think that this summit will likely achieve a bipartisan goal? Will we ever see bipartisanship when it comes to health care in the same sentence?
I don't think that the way that the president has framed this summit that he's going to be able to achieve bipartisanship, because this is unfortunately probably the most partisan president, certainly in my lifetime. And it will be political theater because that's the way that he has staged it. He's been very busy behind closed doors, in secret, now ready with a plan that he's apparently developed to drop that on the American public and the Republicans on Monday, and then telling people that he is giving the Republicans a seat at the table. Instead, it's sort of a bear trap, and they're probably an item on the menu.
Congressman Frost, Republicans, you say, make an enormous mistake by declaring that the health care summit is a failure before it even starts. Elaborate.
Well, look, they ought to go into this with an open mind. If they don't like what the president has to offer, let them say that. But for them all to be saying, oh, this is a waste of time, and why are we even doing this? I think the American public will look at that and say, well, this is pretty cynical upon the Republicans. Let's at least have a dialogue. Maybe they walk out after it's over and say we can't agree, but at least have the opportunity for all sides to be heard. And there is the opportunity, I think, for bipartisanship if people will approach this in the right way. We had bipartisanship several times while I was in Congress. Ronald Reagan, a Republican president, was able to do things with support of Democrats. Not all Democrats were for it, but some Democrats were for it. Also, George W. Bush passed some things with support of Democrats. So let's not close our minds on this. Let's see what happens.
Okay, Congresswoman Miller, I mean, you're hearing a Democrat here saying that Republicans make big mistakes by declaring that the health care summit is a failure before it starts, and also that Republicans risk looking like obstructionists with no program of their own. Would you agree with that?
I do think the president's goal is to make us look like obstructionists, and that's unfortunate. I will say one thing about Senate Majority Leader Harry Reid. He at least is pretty honest about what his intention is. He's already talking about using the most partisan maneuver in within the rules of the Senate, which is reconciliation, so that they're able to go around the filibuster or the 60 vote that is normally needed and just have a majority of 51 vote. And he's basically saying, look, we control the Senate, we control the House, so we have both chambers, we have the presidency. We intend to shove this health care bill that has already been you can see the majority of the American people do not want it, and regardless of what the elections have showed in New Jersey or Virginia, Massachusetts, he is going to shove it down the throats of the American people, and he's honestly saying, watch us do this. That's what raw power is all about.
Now just to be fair here, okay, go ahead.
Julie, if I could remind Candace, I know she wasn't in Congress at the time, but Ronald Reagan used reconciliation early in his term to enact major economic legislation. And people didn't say, oh, isn't it terrible that Ronald Reagan was using reconciliation? This is not the first time that's been done, and we'll see. I would hope that there's bipartisanship so you don't have to use that procedure. But there have been a lot of polls that say the public wants change. They're not opposed to everything that's being offered. Clearly they want to do away with pre-existing conditions. Clearly they want more choices. They want more affordable health care. To say the public is opposed to health care reform is simply not true.
Congresswoman Miller, I'm going to let you respond to that.
I did not say that. I totally agree that we do need health care reform. The Republicans have offered a number of different ideas and solutions, et cetera. And I do think if we can truly be bipartisan, and I come from Macomb County, the home of the Reagan Democrats, I think I know what bipartisanship really can look like. If we truly want to, particularly in this health care summit, hopefully we will scrap this monstrosity of a health care reform bill and start again and rule out reconciliation. I think if the president does those two things, he will find the Republicans with their hands stretched out to him in a true fashion of bipartisanship.
All right, Congressman Frost, if the GOP will not agree to anything, what two choices do Democrats have?
Well, Democrats could take a scaled-down bill, things that the Republicans say they are for, which includes basic insurance reform, doing away with pre-existing conditions, letting you go across state lines to buy insurance, ending caps, and offer it and call the Republicans bluff and see if they'll vote for anything. My guess is they won't vote for anything, even things that they've said they're for. If he chooses not to do that, then he could go with a much broader bill using the reconciliation process, just as Ronald Reagan did in the early 1980s.
All right, that's all the time we have. Congresswoman Candace Miller and former Congressman Martin Frost, always great to have you on. Thank you very much to the both of you. Greg.